Hello, everyone, and welcome to your interviews at Duke Neurology. So I'm Chris Eckstein. I'm the program director for the Adult Neurology Resident Program. I'm very quickly going to just run through a few slides, tell you a little bit about the year, and then, as always, I'm available by email if there's other questions about our program that pop up, and I'm sure Sujay can give you our contact information. So this first screen, what you're going to see basically is a whole bunch of names that you don't necessarily have to remember. The pictures you see are really our departmental leadership. So the top one is Rich O'Brien. He's our chair. He basically goes by Rich. He's very approachable, done a lot of good things for this department in the past 5 or 6 years that he's been here. And then Dr. Sinha, there is the previous program director prior to my taking over a couple of years ago. And then Andrew and Suma are our associate program directors. So we have a whole bunch of faculty, listed on these, and the idea here is we have pretty much every specialty available that you can imagine, with fellowships available, some of which are open to you guys as well when you come through. So that obviously you're going to spend a year with us, and the goal of that program and the goal of that year in our program in general ideally is to be able to drop you in the middle of nowhere and have you be the best neurologist around, and at least have some idea how to work up anything that walks through the door, at least take the first steps. In addition to our clinical training, we try to give everybody access to other things that we'd like to do: research, administration, education. Now, not all that necessarily applies to you guys because you'll have your own pathway through your program on the pediatric side, but just so you know a little bit about what we try to offer. So we have a pretty large department, roughly 80 faculty, give or take. Seems like they're constantly hiring new people, so it always is kind of above 80 or just below. Almost all of those have some type of clinical presence, whether that's inpatient wards or in the subspecialty clinics that you rotate through. We do have a few that are purely research, but most people you'll bump into in the clinic or on the wards. And as I said, we have just about every subspecialty listed here that we have to offer. If there's something missing, it probably just means that I forgot it. We do have several fellows as well that are available to help out, ask questions, supervise a little bit. The big thing to kind of know about the fellows within our program is we have plenty of patients that you're not competing with them to see necessarily. Other places I've been, I know that fellows are sometimes steal the good patients away. That's not necessarily the case here. There's a few fellows that help out on the stroke team. Most of the time you'll work alongside fellows, and they'll have a supervisory role in the ICU and on the stroke service. Facilities, it's a little hard to talk about these or show these to you too much through virtual interviews this year, but we have a very large hospital, so it's roughly 1,000 beds when you start adding things up. The bulk of what you're going to do during your adult year is going to be on the main campus here. So the consult team, the stroke team, the general team, they are all in the main hospital. You don't necessarily have to go out to other hospitals to do consults or do any kind of coverage. The VA, which you do have a few rotations, is literally across the street. You can walk over there and walk back for conference. So it's pretty convenient. The only place that people end up having to drive is when you're on the outpatient clinic. We have a Maureen Road clinic. That's where our dementia, our neurodegenerative clinics tend to be. It's just a lot easier for folks to drive up to that clinic, park at the building, and walk in. It's only about a mile down the street. Everything else is here on site. And when you're over at Maureen Road, you're over there. You don't necessarily have to drive back and forth. So, so it tends to be pretty easy. I have a few other facilities listed here, Duke Regional, Duke Raleigh. Those are more community hospitals. We have folks that do some community neurology electives occasionally, but you guys will not be rotating out there during the year that you spend with us. So we try to offer a really broad clinical experience. So you're going to see, bread and butter neurology all the way on up to the really bizarre, migraines to very recently we had an amoeba, encephalitis case. So kind of fill in everything in between that, and you'll get a pretty good exposure to adult neurology, both inpatient and outpatient. So that year that you'll spend with us is about 60-40 inpatient versus outpatient when you add it all up. So you'll get to rotate through a lot of the specialty clinics as well. Um, I'll go over the didactics and some of the other things here in just a minute. One of the big things I want to point out here when we talk about clinical exposures, we try to treat all the pediatric neurology residents exactly the same way as we treat our adult neurology residents. And so you guys will go through the same rotations with very few exceptions, meaning you guys do a few weeks of peds, whereas our residents don't do that until later in their residency. Other than that, it's all the same rotations, both the inpatient and the in-clinic. Call and night float are all essentially the same. So you're going to be joining a class of 7 adult residents to make it basically like we've got 9 residents in that class. As far as I'm concerned, when you're with us, and you're one of my residents just like the other folks are. And if for some reason I forget and don't treat you that way, then feel free to call me out. So, but we try very hard to be one big program here. So this is kind of a sample rotation schedule of what you guys would have. The numbers vary kind of year to year, but this is a pretty close estimation. Feel free to pause and take a look at that. Didactic schedule, pretty standard. We do conference just about every day. We have noon conference with food. Currently, it's all via Zoom. So we do have kind of grab and go food. So you come pick it up and then you go off and you can Zoom the conference from someplace else. Morning report a couple of days a week. That way we keep the night flow people, in touch with everyone else. Kind of a live handoff essentially is how we treat it. And then we have interesting case conferences on Thursdays or Tuesdays during interview season. During the first month or so of the year, we really try to protect you from night float as much as possible. That way you can be around and see the introduction to neurology didactics. That's a really good series where basically you learn about, ICU, strokes, status, the things you really need to know to kind of get moving quickly. We also do joint conferences with the ER during the year. That way we can kind of make sure everybody's on the same page when it comes to things like strokes and acute calls. So recent changes, so we've added Suma Shah as an associate program director relatively recently. We've always got rapidly expanding faculty, it seems like. There's always somebody new walking around that I haven't met yet. When it comes to the services themselves, we've started to add APPs to the inpatient services. We've added 2 APPs to the general service over the last year, and that's worked out really well to kind of help out with the volumes and kind of non-teaching cases to some degree. And we just hired someone who's going to be joining the consult team as well. So we've got an APP that's going to be starting in the next few weeks there, who's also going to be trained to do acute strokes, that'll cover strokes during conferences, and when, if we're short or if we just need another person to do it. So I think that's been a big change, and it's been a big help to the residents over the last year. Everybody's really been in favor of it. We've got a pretty good group. They work hard, they play hard, obligatory resident pictures here. I think the big thing to take away here is that, when you're with us, we really try to treat you the same. We give you graduated increase in responsibility, just like we do our PGY2s. You will do a lot of the same thing. You'll always have in-house backup during the nights, just like our PGY2s do. That means you'll be the person who's taking the calls. You're the one who's running down to the ER if that's where you need to go. But there's always someone there that can help, who can supervise. And actually during the first few months of the year, they're going to be with you on every single call that you go down there for. And then throughout the year, we'll kind of give you some increased independence as you become more comfortable and as we think you're ready for it. That's probably the biggest takeaway here, is that as far as I'm concerned, we'll treat you just like one of the PGY2 neurology adult residents. Everything from the supervision to the responsibility to the to the rotations that you do. You'll be at every social function if we get to have any over the next year. Traditionally the peds folks here have been a really strong addition to our program, and I've been really impressed with what I've seen during that time. So really hope you guys check out the program, and if you have any questions, I'm sure Sujay can get you in touch with me. All right, good luck with interview season, guys.